Good day, everyone. I am Robbie Dumagsa from University of Mindanao Bansalan College, Bansalan, Davao del Sur, Philippines. And I am here to present my study all about the experiences of personnel of the Tribe Bureau amidst the COVID-19 pandemic crisis. Now, the problem situation of the study. The novel coronavirus disease 2019 or the COVID-19 pandemic arguably represents the worst public health crisis of the 21st century. Despite global efforts to mitigate disease spread, virtually no aspect of daily life remains unaffected. Hang 2020. Now, to discuss the importance of studying the main topic, the importance of this undertaking is for everyone to know and understand the experiences of the Tribe Bureau personnel during the COVID-19, despite the challenges faced, particularly for being able to work outside and be susceptible to viruses. Philosophical paradigm of the study. Resilient researchers vary in their views about what qualifies as adversity, Luther et al. 2000. In contrast, the subjective approach to defining adverse events considers adversity to encompass any events that the person perceives to be disruptive to his or her working environment. The theories, viewpoints, and perspectives about the main topic. This study was anchored in Ratter's Resilience Theory 1985, wherein he considers resilient people as having a greater sense of self-efficacy and strong self-esteem who display an action-oriented approach to problem solving besides being capable of engaging the support of others. The literature and related studies of my study, the Bureau of Jail Management and Penology addresses the numerous challenging issues related to administering jails during the peak of the COVID-19 pandemic, with a specific focus on the well-being and responsibilities of jail personnel. The proximity, confined area, and high population density made the individuals vulnerable to the COVID-19 outbreak. Persons deprived of liberty or PDLs have become increasingly vulnerable, especially in countries with overwhelmed criminal justice systems like the Philippines, Kahapay 2020. Furthermore, the experiences of the Philippine National Police during COVID-19 have been a big help in the Philippine history. The Philippine National Police plays an integral part in halting the spread of COVID-19 by executing the policies started by the government alongside the other frontliners from different areas. They are responsible for the assurance of the public security and maintaining order in response to the national health crisis, Busano et al. 2021. Now, the research scope of the study, based on research and published studies related to the lived experiences of personnel of law enforcement bureaus, there were no studies conducted so far demystifying and told stories of employees at the height of the COVID-19 pandemic as far as Region 11 and the province of Davao del Sur is concerned. Even even before the COVID-19 pandemic, there is limited literature that reveals the experiences of these personnel. In addition, there were problems even in the local sector, and institutions employed no research have recorded such cases. Now, the purpose of the study. This qualitative phenomenological study will explore the lived experiences of law enforcement bureau personnel at the height of COVID-19 pandemic. This study intends to describe the personnel's experiences, their coping mechanisms, and the insights they could share with new personnel. The significance of this study can be of great importance to the Tri Bureau in inculcating experiences and insights to the new Tri Bureau personnel and informing and sharing everyone about their challenges during the COVID-19 pandemic crisis. Now, the limitations or weaknesses and delimitations of the study. The general purpose of this study was to understand and explore the experiences of Tribe Bureau personnel at the height of COVID-19 pandemic crisis. This mainly focus on the research participants' experiences, their coping mechanisms, and as well as their insights. Thus, the study only limited its participants to personnel of the Tribe Bureau from Davao del Sur. The study participants, personnel who come from the following bureaus, will be qualified to become participants in the study. The Bureau of Jail Management and Penology, or BGMP, from the Bureau of Fire Protection, or BFP, and as well as from the Philippine National Police, or PNP. Moreover, purposive sampling will be used to select participants. Itigan et al. 2016 stated that the purposive sampling technique, also called judgment sampling, it is the deliberate choice of a participant due to the qualities and participant possesses. Thus, only personnel who live in any municipality or city of Davao del Sur will be chosen through the help of the training coordinators and heads from the different agencies. The participants will be 23 to 50 years old. A tribe bureau from BGMP, BFP, and PNP personnel assigned in Davao del Sur and have served during the COVID-19 pandemic crisis. This study will exclude the Tribe Bureau personnel, especially those recruited after the COVID-19 and assigned to another province. Also, this study will exclude those who were retired. Now, the materials and instrument of this study. In the qualitative phase of data gathering, the researcher constructed an interview guide questions and collected the responses of the selected participants regarding their experiences. The experts verified this researcher made interview guide or protocol to check the instrument's consistency, the validity, and reliability. Hence, the data source will be gathered through IDI or in-depth interview. Now, the design and procedure of this study. The qualitative phenomenological research design will be used in this study. Phenomenology is qualitative research that focuses on a group's shared experience. The approach primary purpose is to come up with a description of the nature of the occurrence in question. Now, the trustworthiness. Qualitative approach purports to achieve trustworthiness during the evaluation. Validity and reliability in qualitative research is more of consistency in pattern development than statistical validation of an instrument in quantitative research, Creswell 2007. Terms often used to convey a sense of believability in a qualitative research design, project are trustworthiness, authenticity, and credibility. Now, the ethical considerations of the study. Research ethics deals mainly with the interaction between researchers and the people they study. Mack et al. 2005. This means that the study's prime concern shall be the research participants' well-being. The present study will follow a protocol to ensure scientific soundness and ethical issues. No trace of any misinterpretation of the interviewees and participants will be committed, and details of the paper will be carefully written to circumvent plagiarism. Now, here are the results of the Table 1, the themes on the experiences of the Tribe Bureau personnel during the COVID-19 pandemic. The first theme, feeling anxious about the spread of infection, with these core ideas, scared of infecting the family members at home, anxious of having the virus, disturbed of getting close with patients, worrying that we might have the virus with us, stress brought by getting quarantined, anxious of being isolated, and as well as worrying about the health of family members. Another theme is the experiencing work burnout, and has these core ideas: discomforts of wearing PPEs, exhaustion due to public disputes, overworked and longer duty hours, restless and exhausted with so many patients, no more time for the family, and choosing not to go home other than unknowingly bringing the virus at home. And another theme here is the shifting of new tasks to perform, having the core ideas from a fireman to a swabber, and being assigned as a swabber other than serving as a police officer, serving as a patient responder other than serving as a police officer, providing public information. So here are also the sample responses coming from the table. Yes, ma'am. During COVID-19, ma'am, we undergone lockdown, ma'am, to minimize the transfer of virus because it is very hard in the first place. We are overpopulated and it will be easy for virus to be transmitted. Of course, ma'am, I can feel stressed, but work is needed to be performed, said JO. The level of our anxiety is very high, especially those times when we don't know the medicine. There were times that we were afraid. For example, we have our colleagues that has coughs, and it will lead us to our anxiety, according to the epic. I can describe the challenges in our bureau. You cannot say that you are tired, but there are really times that you could say you are exhausted, said the FP1. Physically, ma'am, I do sports even if it is not my hobby. So the experience that we went through was very tiring with regards to wearing our PPE. Even if it is so uncomfortable to wear, though we were used to wear it, but not all the time that our body is in good condition, said AJ01. That feeling of happiness because you help someone, you contributed to the community, but it is so sad knowing I can't go home with my family because almost 1 year I got home after 4 months, said BFP4. For us fire officers during employment, we became swabber. Who initiates swab test, said BFP4. Now here are also the results of the table 2 with the themes on coping strategies of the tri-bureau personnel at work during the COVID-19 pandemic. The first theme is the individual vitality practices, having the core ideas of doing daily physical exercises, playing online games once in a while, and watching movies while in quarantine, reading books while in quarantine, and sharing good laughs with the colleagues. Another theme is the thought orientation, having the core ideas of setting the mind to withstand anxiety, encourage inner inspiration, keep a focus in performing the task, employ self-emotional management, finding joy in tasks despite feeling anxious, and enjoying work amidst inner tension. Another theme, finding solace in spirituality, having the core ideas of seeking comfort in spiritual practices, finding refuge in spiritual pursuits, asking God's forgiveness for sins committed, asking God for strength and physical well being. And another theme, overwhelming support system. Having the core ideas of circle of support from colleagues is vital. Compassionate care from loved ones, rooting strength from loved ones, sharing similar thoughts and experiences with the friends. Now, here are the sample responses of the table 2. We have forums with my colleagues and we share our feelings for us to know. Spiritually, yes, ma'am. We do forums and Bible sharing. With our colleagues, we have constant communication. We initiate what we must do to divert. Then we call our families for morale to update your morale, said JO1. I do jogging, ma'am, and basketball. Also online games, mom, said JO2. It is already in the mind that this is really our work and we must enjoy it, said PNP1. Now, the results of the table 3 on the themes on the insights of the Tri Bureau personnel about their experience. The first theme, adhering to procedures and effective communication is crucial with the core ideas. Others do not follow, hence problems arise. People must abide with the rules. Information dissemination is important. Clear instruction and information are essential. And as well as following protocol is vital. Another theme is emphasizing the necessity of disaster readiness. With the core ideas of disaster readiness is crucial, stressing the critical nature of disaster preparedness. Proactive disaster planning must be in place. Robust preparedness measures help a lot, and cooperation of personnel is essential. Another theme is that stay true to the oath of responsibility with the core ideas of staying true and loyal to the public, live up to the duty promise, able to extend service, willingness to exhaust all means for others, and willingness to serve beyond duty hours. So here are the sample responses from the table 3. At first, you thought it was just simple, but because of stubbornness, the virus spreads. So we need to follow the rules of the government, mom, because they always look after us for our good. We need not to be stubborn. If people listened, we could have not experienced this. Most especially social distancing, wearing of mask, there were few people. It also has face shield. A few people did not wear face shield anymore because it was very hot that time. The lesson I've learned from COVID-19 was we need to listen to our government. For example, the DOH to prevent the recurrence of pandemic. So now here are the discussion of the experiences of Tri-Bureau personnel during the COVID-19. First theme is the feeling anxious about the spread of infection. So during the COVID-19 pandemic, the spread of the virus exhibited a significantly elevated incidence of depression and anxiety. Hang et al. 2020, Center for National Health and Statistics 2020. Moreover, in a study, fear of spreading the virus to the family, friends is one of the top 5 responses of the participants. Rasposa et al. 2023. Experiencing work burnout. Work-related burnout encompasses symptoms of exhaustion that are thought to be directly linked to an individual's professional responsibilities. Hayes et al. 2020. Another theme is the shifting of new tasks to perform. The COVID-19 pandemic has brought unique work to individuals. Study discusses about employment resources are necessary for addressing challenges such as the lack of clear understanding of one's responsibilities. Payne and Kinman, 2019. Now, coping strategies of the Tri-Bureau personnel at work during the COVID-19 pandemic. First theme is the individual vitality practices. Shared by the Tri-Bureau personnel, they have individual vitality practices just like doing physical exercises and the likes. Accordingly, in a study, several fire, police, and health workers experienced less psychological distress and increased resilience compared to the overall population throughout this period. Pink et al. 2021. Another is the thought orientation. The COVID-19 pandemic has emerged as a formidable obstacle for the contemporary world. An individual's self-perception and their assessment of their ability to handle challenges play a crucial role in their mental well-being and overall state of health. A crucial characteristics for efficiently managing challenges is having a positive orientation, a consistent mental inclination that contrasts with despair and is linked to a favorable perception of oneself, one's life, events, and the future because individuals that possess a positive mindset are more adept at managing the difficulties posed by the pandemic and exhibit optimism toward the future. Demika et al. 2023. Another theme is the finding solace in spirituality. Spiritual awareness can liberate individuals from the constraints of COVID-19 by providing practical and productive remedies while maintaining adherence to the health regulations. They could enhance their resilience by acknowledging the pandemic as a manifestation of Allah's divine decree. Recognition of the sickness facilitates individuals in accepting it more effectively, um, and the outcome can be enhanced via religious devotion. The spiritual well being of survivors plays a significant role on their physical health, which is a crucial aspect of the recovery. Arika and Taufik 2023. Another is the overwhelming support system. A support group is a collective of individuals who share similar experiences and problems, offering each other emotional and moral support. That is you 2017. Support systems aid in managing the challenges during the pandemic through group activities such as expressing emotions, receiving support from peers, confirming shared experiences, and learning from peers, receiving guidance from group facilitators, and other related activities. Viswanathan et al. 2020. Now, the insights also of the Tri-Bureau personnel about their experience with the team, adhering to procedures and effective communication is crucial. This core idea, according to the evidence presented in this review, effective communication in the context of NPI adoption or adherence should adhere to the following principles. First, information should be conveyed transparently, avoiding any conflicting or mixed messages. Second is the reliable sources, such as health authorities, should convey information. Third is that communication should strike a balance between being authoritative and avoiding language that may be perceived as controlling. For example, avoiding the phrases like you must. Williams et al. 2023. Another is emphasizing the necessity of disaster readiness. Significant advances have been made in the realm of disaster and preparedness over the past few decades. Forecast et al. 2021. A study explained various strengths were essential, and it was recognized based on their expertise and capabilities in disaster preparedness, including the establishment of a comprehensive framework for responding to and adjusting to the COVID-19 pandemic, as well as the seamless integration of COVID-19 response into their regular disaster preparedness efforts. Palinkas et al. 2021. Another is the stay true to the oath of responsibility. Several states, also the Philippine government, have implemented lesser-known legislation that grants government officials the authority to compel healthcare personnel to work during officially declared public health emergency. Even if such action may entail life-threatening hazards, these were just part of the job functions of the public or government employees that need to be as resilient as they should be, and that is the call of duty. Coleman, 2008. Now, the confirmation of the theory. So the results of this study explained the theory of Ratter's resilience theory in 1985. Furthermore, this study proved that resilient individuals are characterized by a heightened sense of self-efficacy and robust self-esteem. According to the above-mentioned themes, like staying true to the oath of responsibility, overwhelming support system, and the likes, the Tri-Bureau personnel demonstrate a proactive attitude to tackling problems and possess the ability to seek support from the others. Concluding remarks of the study. In the course of the conduct of the study, I, the researcher, learned that Triburo personnel were resilient and true to their oath of responsibility despite of the trying times. I discover the lived experiences of the Triburo personnel wherein they too have experienced work burnout, had a feeling of anxiety, scared of being able to infect their family and friends. And they too are flexible with the task given to them, even if it requires life to death situations. And the implication for practice, the result of the study would benefit the future and other Triburo personnel, that they would be inspired and motivated by the experiences of the participants in the study in dealing with the work burnouts and other work-related mediocrity issues that may occur in the future. Additionally, this study would benefit the future researchers that they would get ideas and references, especially on the lived experiences and coping strategies and insights shared by the Tribe Bureau personnel during the COVID-19 pandemic. Now, for the future researchers seeking to utilize this research as a reference for their own study, it is advisable to investigate this occurrence across a broader scope of geographical locations and academic disciplines. So, in order to distinguish experiences, the coping mechanisms, and insights during the COVID-19 pandemic, future researchers should explore the possibility of recruiting participants from agencies like AFP, Coast Guard, and others rather than solely relying on participants from the Tribunal. So, again, thank you so much. Your presenter, Rubigen S. Dumagsa from University of Mindanao Bansalan College, Bansalan, Davao del Sur, Philippines. Again, my research title, all about the experiences of personnel of the Tri Bureau amidst the COVID-19 pandemic.